The last video I did was regarding breast implant illness and SIBO, small intestine bacteria overgrowth. I was talking a bit about that and then stating that I was getting the SIBO test. Every 15 minutes, you had to grab a new tube and blow into the tube and then seal it and label it. I did all that. I did it, followed it actually to the max. I got the results from the SIBO test and everything came up negative, which is really odd for me because I was following some of the guidelines like avoiding onion and garlic and staying off the cauliflower and lots of different foods, right? I looked up the FODMAP foods, like what was good for me, what wasn't good on a FODMAP level, and I was following it and still I'm following it, and I feel like I've had some relief from the intestinal issues, the bloating, the distension is less. I'm eating a lot more protein. Definitely have lowered my carbs, like I've stated, but I've lowered it even more. Just doing like a small amount of squash, like 2.5, 3 ounces of squash instead of like my 6 ounces or 12 ounces. Really trying to reduce the fiber vegetables. Feeling some relief, but was surprised that the results came back negative. I felt that that was probably the issue, that I had the small intestine bacterial overgrowth. And I also stated in the last video that I was not going to have my implants removed. And for whatever reason, like after the video, I was then watching additional information about breast implant illness, and I decided that I am going to have the implants removed. Yeah, I am going to have my implants removed. I have a G cup at this present time, so I don't know with the implants being removed, will I be at a B? Would I be at a C? I don't know. I know I have my own breast tissue. And then I noticed in the video when I was talking that I was like, oh, I've had these symptoms for 4 years. Well, for 4 years, that's the length of time I've had my implants. And one of my implants, the videos are here. I talked about it where I had a encapsulation on one of the breasts, and I had to have that breast implant removed and replaced. I kind of wish back then I would have known about BII. I would have probably had them both removed at that time. Again, I stated the aesthetics are cool. They are bigger than what I anticipated. And with my HRT hormone therapy, I believe they've gotten bigger because of the hormone therapy, especially the progesterone. The breast implant removal is already approved. Now, what I am proposing to my surgeon, Dr. Adam Perry, I want to know if a breast lift could be covered by insurance with the implant removal. It's possible. It's possible. Being that I have gotten the encapsulation on one of the breasts, and the reason why I wanted to have them removed, even before I really was convinced that it's probably the breast implants that are giving me the digestive problems, the fatigue, the brain fog. I've had little itches and rashes too. I thought maybe it was detergent or a different, brand that I'm using or whatever. It could be the fact that it's the implants. But after the video, what really, really dawned on me, the light bulb that went over my head for real, for sure, that allowed me to say, yes, I'm going to have them removed. And let's see if I can get a lift. If I can't get the lift included with the insurance, that's fine. I'll still have them removed. It dawned on me in the conversation on that video, editing it. When I had my MRI, I didn't mention this. The neurologist was like, listen, you have brain inflammation. Well, it's nothing serious, but you are inflamed. And I'm like, well, maybe it's the implants that are causing the inflammation. I'm not sure. I know I've had a history, but it's a long, long time ago, 35 years ago, of like a lot of sugar consumption, a lot of alcohol abuse in my past, a lot of carbs, a lot of sugars. Like I said, even in my food recovery, eating much, much healthier, gave up alcohol, gave up cigarettes, gave up diet pills. I was really tripping out in my younger days. Diabetes runs in my family. I say I have a diabetic brain because the way I eat and what foods seem to trigger cravings is very diabetic in nature. I don't know if that's going to make sense for you, but they say that some folks have the diabetic brain, which the sugars and the carbs can add to the brain fog. Finding out that the SIBO test came back negative, and then realizing that my neurologist did say that I had inflammation of the brain, I felt like, what have I got to lose to have my breast removed? And the breast size comes with a lot of judgment, a lot of perception of folks thinking I'm a certain type of, woman. And, I'm really very pretty conservative. I talk a good deal. I look like a hot mess in that way, like hot to trot, very Jessica Rabbit look, worshiper of Jessica Rabbit. Again, I'm not bad. I'm just drawn this way. And I wasn't asking for big boobs when I went for the breast implants. I didn't know what questions to ask. Like, okay, my breasts are like this now. What are my breasts gonna be after surgery? I didn't ask. We both agreed we weren't gonna go big. We were gonna go with a size that would be good for my frame. Even at that time, didn't have a clear understanding of breast cup sizes. It's only now, finally, that I learned almost 4 years in that I'm a G. I was shocked. I was like, no way. I thought I was a 38C. I'm a 32G. And I don't know what I'm going to be like, what size I'm going to be after the explant. So I wanted to come to you all just to give you an update that the SIBO test came back negative and that I've put in to have the implants removed. And now I have to wait for my surgeon to get back to me to let me know if the breast lift will be covered by insurance and doing the explant of the breasts at the same time. I heard when you don't get the breast lift done, you should not look at your breasts for the first 2 weeks, which I could do. I disassociate. Even with this fabulousness, can you imagine? No, I tend to disassociate because of my body dysphoria early on and then gender dysphoria. I'm like, I don't know what the hell I look like. I don't want to know. But I'm always looking in the mirror, but I don't know if what I'm seeing is real, still. Some of us are just so perfect and blessed, right? But anyway, so that's what's going on. SIBO is negative, and I'll be having the implants removed hopefully soon. I'll keep you posted on that. I will miss them. I love them. I adore them, and I always caress them and tell them that I love them very much. But I've had it with the implants, and I don't want the encapsulation to happen again. Sometimes I get sharp pings every so often, which is similar to like what was going on the first round. And then it did end up getting encapsulated. So I'm just gonna just go forward and let them go and release them. So, and my hair is curly today, is no longer magenta. And I'm gonna be sporting curly for a while because I really want like down to here curly. But anyways, that's what's going on. A day in the life of trans Puerto Rican mama. I am the queen of healthy Latin cooking. Welcome to my show. Y'all have a good day. Thanks for watching. Mwah, mwah, mwah. Bye.